Sacred Heart Hospital smells like antiseptic and institutional bleach, the kind that burns your sinuses on the first breath and never stops. Elena Martinez moves through the pediatric ward in navy scrubs faded from 100 washings, her dark hair pulled so tight it creates a permanent furrow above her left eyebrow. She touches the single dog tag on a broken chain under her scrub top during shift change, a private ritual no one notices. Just a nurse. That's what everyone here thinks, and that's exactly how she needs it to stay. The fluorescent lights hum their constant electric drone above sterile white floors that reflect back the faces of residents and interns moving like they own the place. Elena doesn't own anything anymore. She gave that up in Tikrit when the mortar round found her left side and the army decided her 23 years of service were finished. Now she works night shifts in pediatrics at Sacred Heart in Philadelphia, a city far enough from Walter Reed and the questions that came with discharge. A city where no one knows her name is really major. She triple-checks medication doses on the cart at 0630 hours, the way she was trained to triple-check ammunition counts before a mission. A decimal error in another nurse's charting catches her eye during her review, 1.0 mg instead of 0.1 mg for a 6-year-old with seizure prophylaxis. She corrects it silently, leaving no note, asking for no credit. The resident finishing her for line on the new admission in room for 12 has the needle angled wrong, will cause infiltration by afternoon. Elena catches his wrist gently as he's sealing the site, adjusts the catheter maybe 2 millimeters. He doesn't ask why. Doesn't question her. Just knows. Dr. James Ashford, Chief of Pediatrics, sweeps through morning rounds at 0700 like a general inspecting troops, for residents trailing behind him in descending order of seniority. He moves with the kind of precision that comes from knowing exactly how important he is. His tie costs more than Elena's entire monthly rent. His watch is a Rolex Submariner worth what she made in 6 months overseas. He barely glances at the nursing staff, addresses the interns about vitals and lab work, mentions a board meeting at noon, and says something about maintaining standards at Sacred Heart that carries the weight of a threat wrapped in administrative language. The ER doors burst open at 08 for 7. A man in a marine dress uniform carries an 8-year-old girl whose screams echo down the hallway like a siren that won't shut off. The girl's face is pale, streaked with tears and sweat. Her stomach is rigid under her pink unicorn t-shirt, and when her father sets her down on the stretcher in Trauma Bay 3, she arches backward and screams again, a sound that penetrates every single thing Elena is doing and turns her entire body into a tuning fork. Commander. The rank insignia is visible on his chest, and his hand trembles as he grips his daughter's shoulder. Sophia, the chart says. 8 years old. Severe abdominal pain onset 3 hours ago, vomiting once, hasn't eaten since dinner last night. Father reports no recent illness, no travel, lives in Fairmount, no known drug allergies. Elena watches from the nurse's station while pretending to check something on the computer. Her body doesn't move. Her breathing doesn't change. But something in her recognizes something in that child's presentation, the way the pain comes in waves, the way she curls inward, the rigidity of the abdomen, the vomiting pattern, the fever reading of 102.4. Her hands know things her brain hasn't said yet. Dr. Chen arrives first, then Dr. Patel. Both run standard emergency pediatric assessment protocols. Abdominal exam. Check for appendicitis signs, they press McBurney's point, get a scream, assume pain response. Check for gastroenteritis presentation. The fever could support viral. The vomiting confirms it. The commander is asked 100 questions about recent stomach bugs, food exposure, school illness contacts. His voice cracks when he answers. His daughter screams louder when they press her stomach. By 09:20, Dr. Morrison has joined the assessment. Then Dr. Kozlov. Then Dr. Richardson. Then Dr. Webb. 7 doctors, all agreeing on the same diagnosis: acute gastroenteritis, likely viral, possibly bacterial. Supportive care. For fluids. Anti-nausea medications. Send home after observation. They speak over the girl's cries like she's background noise. They speak over her father's questions like his background noise too. Elena watches. Her left leg aches where the shrapnel sits, not deep enough to remove surgically without risking the femoral artery. She's learned to walk on it like it's not there. She's learned to do a lot of things like they're not there. She charts vitals from her station. Sophia's blood pressure is 94/62 for an 8-year-old, which is borderline low, but young children compensate well. Heart rate is 128, tachycardic, which they're attributing to pain and fever. Respiratory rate is 24, elevated. Temperature holding at 102.1. Elena looks at the girl's position on the stretcher, the way she's curled on her right side, the way her knees are drawn up, the way her pain is localized to the right lower quadrant even though she flinches when they press anywhere on her abdomen. That's not gastroenteritis pain. Gastroenteritis pain is diffuse. This pain has a specific location. This pain has a story. At 1015, rounds happen. Dr. Ashford enters Trauma Bay 3 with his entourage of residents. He glances at the chart, glances at Sophia who is now whimpering between waves of pain, glances at her father who looks like a man trying not to break apart. Ashford's assessment takes approximately 90 seconds. He dictates his conclusions to the residents in a voice pitched for teaching: acute gastroenteritis, likely viral onset, supportive care protocol, discharge after observation window, follow up with primary care if symptoms persist. The commander asks if there's anything else that could cause this. Ashford's smile is the kind that happens when a question has been answered incorrectly and the person asking should know better. Elena is checking the medication cart when Ashford walks past the nursing station on his way out of Trauma Bay 3. She doesn't look up. She doesn't change her expression. She doesn't do anything that would suggest she noticed the tremor in Sophia's father's voice or the way the girl's pupils dilated when the doctors pressed her right lower quadrant. But she does pause for exactly 3 seconds before reaching for the next medication dose. The assessment pause her field medics in Tikrit once knew meant she'd seen something that needed marking. The door closes. Ashford is gone. Sophia continues screaming. Elena finishes charting. She makes a notation in the nurse's assessment section of the chart, the part that residents never read, the part that exists for the record: right lower quadrant pain localized. Rigid abdomen. Rebound tenderness positive on press. Fever pattern consistent with acute inflammation rather than viral infection. Recommend surgical consult for appendicitis rule out. She signs it. Elena M. RN, 1015 hours. Then she steps away from the station, hands the chart to the charge nurse, and doesn't say a word about it. That's how it works when you're just a nurse. You chart what you see, you move on, you let the doctors make the decisions, you keep your head down and your theories to yourself. That's how you survive in places like Sacred Heart where hierarchy matters more than what you know. But at 10:47, when she walks past Trauma Bay 3, Sophia is still screaming. Her father is holding her hand. Before is running. Ashford's diagnosis sits on the chart like gospel, and Elena moves past like she doesn't see the girl's skin going slightly grayish under the fluorescent lights, like she doesn't notice the rapid shallow breathing that's changed in the last 30 minutes, like she doesn't recognize the compensation pattern that comes right before a young body starts to fail. She doesn't say anything. She's learned how to swallow what she knows. She's learned how to survive without speaking. She's learned that there are worse things than being wrong in a hospital. But there are also things far worse than keeping quiet. Dr. Ashford stands at Sophia's bedside like a conductor before an orchestra, his white coat perfectly creased, his stethoscope draped across his shoulders with the casual confidence of a man who has never been questioned. Around him, 7 physicians nod in synchronized agreement: Dr. Chen, Dr. Patel, Dr. Morrison, Dr. Kozlov, Dr. Richardson, and Dr. Webb, all of them reading the same labs with the same conclusion already written across their faces. Elena watches from the doorway, her hands gripping the chart so tightly the paper creases beneath her fingers. Classic viral gastroenteritis, Ashford announces to Commander Hayes, his voice the texture of expensive bourbon, smooth and deceptively warm. Fluids and rest. She'll be fine in 48 hours. Send her home with anti-nausea medication and strict clear liquids. Standard protocol. He turns to Sophia, who lies curled on her side, her small face grey-green with pain. You'll feel better soon, sweetheart. Your body just needs to fight off this bug. Elena steps forward. Her movement is quiet, practiced, the kind of approach that announces intention without aggression. Doctor, her pain is localized to McBurney's point. She has rebound tenderness on palpation, and her white count is. Ashford cuts her off mid-sentence, turning to face her with the theatrical slowness of a man performing for an audience. His jaw tightens into something that resembles a smile. I'm sorry, Nurse Martinez, did you complete medical school while I wasn't looking? The residents snicker. The sound is small but deliberate, like lighter fluid being poured. This is why we have a hierarchy. Nurses observe. Doctors diagnose. Or did they not cover that in your community college program? The silence that follows is the kind that makes monitors sound louder. Commander Hayes shifts uncomfortably, his shoulders tensing. His daughter's small hand reaches for him from the bed. Elena takes one measured breath. Her jaw tightens at the hinge, a single muscle contracting and releasing. She does not look away. That little girl's presentation suggests appendicitis, not gastroenteritis. Ashford's smile turns cold, the way a knife's edge catches light. Commander Hayes, I apologize that our nursing staff doesn't understand professional boundaries. Nurse Martinez, see me after rounds. He turns back to the family as though the conversation has already ended, as though Elena has already been dismissed. As I was saying, simple gastro. You'll be home by this evening. 2 days pass like holding your breath underwater. Sophia returns to the ER at midnight, worse than before, her abdomen more distended, her fever climbing to 104.2 degrees. All 7 doctors examine her again. All 7 reach the same conclusion. During morning rounds, Ashford summons Elena to present Sophia's case in front of the entire team, residents, interns, attending physicians, and the Hayes family gathered like an audience in a theater they didn't choose to attend. Elena presents the vitals methodically. Temperature. Heart rate. Abdominal exam findings. When she mentions her concern about appendicitis, her voice steady and clinical, Ashford interrupts before she finishes the second sentence. So Nurse Martinez believes 7 board-certified physicians, including myself with 23 years of experience, are all wrong, and she, with her associate degree, is right. His voice carries the weight of absolute certainty, a man whose authority is so embedded in the hospital structure that questioning it feels like questioning gravity. The residents exchange glances. This is what happens when we let Florence Nightingale here play doctor. Stick to bedpans, sweetheart. Commander Hayes looks at the floor. Elena's hands do not shake. Her breathing does not quicken. One tear traces down her left cheek, a single bead of salt water that breaks through before she catches it with the back of her hand, wiping it without looking away, without flinching, without acknowledging that it ever happened. My concern is for your patient, doctor, not your ego. The room goes so quiet you can hear the ventilator in the adjacent bed cycling through its mechanical rhythm. That afternoon in the break room, Elena sits with her lunch tray. 4 nurses at her table stand in unison, their chairs scraping against tile in a sound like armor being removed, and move to another table without a word. By evening, a memo circulates through the nursing staff from Dr. Ashford's office. It speaks in the careful language of institutional protection, professional boundaries, chain of command, maintaining physician authority. By week's end, he posts a formal write-up on the unit board that will be read aloud at the nurse's station. His voice when he reads it carries the precision of a prosecutor presenting evidence. Effective immediately, Nurse Martinez is on formal probation for repeated insubordination, questioning physician judgment, and creating a hostile work environment for medical staff. He pauses for effect, letting the words settle like sediment. Any further violations will result in immediate termination. Are we clear? The evening shift stands frozen. No one nods. No one speaks. The fluorescent lights above buzz with the sound of electricity pushed too hard through aging wiring. Elena takes one measured breath. She lets the silence stretch for 4 seconds, long enough for every person present to understand that she is choosing her words with the same precision a surgeon chooses where to place a blade. When she speaks, her voice has dropped half an octave. That little girl is dying, and when she does, you'll have to live with choosing your ego over her life. She turns without waiting for a response and walks toward the supply closet. Her movements are controlled, economical, the walk of someone who has trained their body to obey commands even when their mind is fracturing. Inside the small room lined with sterile packages and 4 stands, she grips the dog tag beneath her scrubs, the one she has kept hidden for 3 years, the only piece of her old life she couldn't bring herself to destroy. The metal is warm from her skin. She pulls it from beneath the fabric and lets it catch the dim light filtering through the door's small window. Her calloused fingers curl around it until the edges cut into her palm, a sensation that grounds her, that reminds her body it is still here, still real, still functioning despite everything trying to convince her otherwise. That night at 11:13 p.m., Elena is restocking the medication cart on the pediatric floor, running through inventory with the mechanical precision that comes from hours of repetition, when she hears screaming from the ER. Not crying. Not distressed vocalizing. Screaming, the kind of sound that means the body is sending a distress signal the brain cannot ignore. Elena sprints down the hallway. Her limp is pronounced now, the injury from Tikrit flaring up under adrenaline and speed, but she moves anyway, her trajectory unwavering. She finds Sophia Hayes in Trauma Bay 3, her small body convulsing on a stretcher, her eyes rolled back, her consciousness already somewhere else. Commander Hayes stands beside her, his voice cracking as he shouts for help, his uniform suddenly looking like a costume, like something borrowed from someone else's life. The on-call resident is Dr. Morrison, one of Ashford's 7 disciples, already calling out diagnoses with the confidence of certainty. Febrile seizure secondary to viral illness. She needs cooling measures and seizure precautions. Elena pushes past him. Her hands move with combat precision, checking pupils for reactivity, palpating the abdomen, noting the rigid distension that should never exist in an 8-year-old girl. Her fingers know what they are feeling. Her brain translates sensation into data in the language of emergency medicine. Her appendix ruptured. She's septic. Morrison laughs nervously, a sound like breaking glass. Dr. Ashford said. Dr. Ashford is wrong. She is already starting in 4 line, her fingers steady, her movements exact and economical, no wasted motion, no hesitation. The needle slides through skin with the precision of a needle finding thread. She calls out orders for broad-spectrum antibiotics, for fluid resuscitation, for surgical consult. Her voice has changed. It has dropped into a register she has not used in 3 years, the command register, the voice that once directed combat operations under fire. You can authorize that, or you can explain to her father why you let her die while waiting for permission. Choose. Morrison stands frozen, his mouth open, his brain processing the sudden absence of hierarchy in his own department. Elena has the 4 placed, antibiotics running, vitals stabilizing, before Morrison finishes paging the attending surgeon. When the on-call surgeon arrives, a woman named Dr. Reeves with grey at her temples and the eyes of someone who has seen enough emergencies to stop being surprised, she examines Sophia for 30 seconds and confirms what Elena already knows. Ruptured appendix with septic peritonitis. Hours, maybe, before irreversible septic shock becomes irreversible organ failure. Elena physically lifts Sophia, all 53 pounds, light enough to carry like a child, but heavy with the weight of consequence, and holds her against her chest as she moves toward the surgical suite at a controlled run. Her body remembers how to move through crisis. Her feet find the rhythm. Her breathing stays steady. Commander Hayes sprints beside her, his voice urgent and desperate. Is she going to make it? Elena's face is stone. Absolute stone. The kind of stone that has weathered storms. We bought her time. Now it's up to the surgeon. She hands Sophia to the surgical team, steps back, and watches through the observation window as they prepare for emergency surgery. The fluorescent lights overhead cast everything in white. The surgical team moves with purpose, draping the field, prepping skin with iodine that turns everything amber-colored and urgent. And then Elena's hands start shaking. The tremor begins in her fingers and travels up through her palms, a delayed reaction to adrenaline and the absence of immediate danger, the body's way of telling the mind that it can finally acknowledge what nearly happened. She presses both hands flat against the glass to still them, an old trick from Tikrit, from waiting outside operating tents while surgeons worked on the wounded. She stands there as the surgical team begins the opening incision, as they begin the work of salvaging a life that 7 physicians had already written off as routine gastroenteritis, as she becomes invisible once again in the observation window. The surgical lights burn white-hot above Sophia's open abdomen, and the attending surgeon's voice cuts through the room like a blade. Ruptured appendix. Peritonitis. Advanced sepsis. He doesn't pause to explain to anyone how Elena knew. He works. That's all that matters now. The surgical tech calls out vitals. Blood pressure climbing. Oxygen saturation steady at 98%. The antibiotics Elena pushed, 1 gram ceftriaxone 4, 500 milligrams metronidazole, have bought them the smallest window, the thinnest margin between life and the other thing. Sophia's tiny body lies exposed under the lights, and Elena stands in the observation window with her hands pressed flat against the glass, an old trick from Tikrit, from waiting outside operating tents while surgeons worked on the wounded. She stands there as the surgical team begins the work of salvaging a life that 7 physicians had already written off as routine gastroenteritis. She stands there and becomes invisible once again. But the elevator ride down from surgical was supposed to take 4 minutes. It took 6. Someone delayed it. When the doors opened on the 3rd floor, not the pediatric wing, not the recovery suite, Dr. Ashford was waiting. He stepped inside before Elena could process what was happening. His face was composed. Controlled. That was worse than anger. Anger would have been honest. This was calculation wearing a white coat, a man whose reputation had been built on the kind of authority that doesn't tolerate correction from nurses, from anyone beneath his taxonomy of power. He didn't raise his voice. He did the opposite. You directly contradicted my diagnosis. His tone was almost gentle, which made it worse. You ordered medications without physician authorization. You physically removed a patient from the ER without consulting the medical team. He paused. The elevator hummed downward. Fluorescent lights flickered past, floor after floor. You're done. Elena's jaw didn't clench. Her voice didn't rise. She had been trained in deserts where showing emotion meant losing soldiers. She had held a 10-year-old girl's hand while IED shrapnel worked through her left leg, and the only thing the girl could see was Elena's face, which remained still as stone. That was what kept people breathing. That was what kept them sane. So Elena looked at Dr. Ashford and said nothing, which was the only weapon she had left. He made the first phone call from his office at 1:15 a.m. The chief medical officer picked up on the second ring. Ashford had probably been expecting the call, probably had laid the groundwork hours earlier. We have a liability crisis in pediatrics. Unauthorized medication administration. Chain of command violation. I need her suspended pending investigation. The conversation lasted 90 seconds. It was professional. It was devastating. By 1:45 a.m., the chief medical officer had approved the suspension. By 2:15 a.m., Ashford had called 2 board members. By 2:38 a.m., he had called the hospital's risk management attorney. By 3 a.m., Elena Martinez's keycard access had been reprogrammed. She could no longer enter pediatrics. She could no longer access surgical recovery. She could no longer exist in the part of the hospital where Sophia Hayes was fighting for her life. Ashford personally escorted her to the elevator that descended to the basement level where the psych ward lived, a floor that felt separate from the rest of the hospital, a place where people with broken minds waited for medication to make them functional again. He walked beside her with his hands in his pockets, a man who had just eliminated a problem. You will not go near Sophia Hayes's recovery room, he said as they walked. You will not contact the Hayes family. You are restricted from pediatric floors pending investigation. He paused at the elevator doors. Hospital protocol prevents nurses from treating cases where they've shown emotional involvement. It's a liability issue. Surely you understand. Elena understood. She understood that he was afraid. Not of her competence. Of her being right. Of a major medical mistake being traced directly to his arrogance. She understood that smart people destroy evidence before it can destroy them. She didn't respond. She stepped into the elevator. The doors closed. She descended into fluorescent light and the hiss of the ventilation system, and nobody moved to stop her because nobody could. The double shift on psych was meant to be a punishment. Elena managed 17 patients on medication rotation, intake assessments, and 2 suicide watch protocols that ran until 4 a.m. A man with untreated schizophrenia kept trying to tell her that his wife was broadcasting his thoughts through the hospital speakers. A woman who had attempted overdose kept apologizing for existing. Elena moved through those hours like she was programmed, her hand steady, her voice calm, dispensing medication and compassion in measured doses. By the time she clocked out at 6 a.m., she had been awake for 18 hours. She went home. She slept. She woke at 2 p.m. the following day and drove back to Sacred Heart without thinking about why. The elevator to the surgical recovery floor didn't respond to her key card. It simply refused, the reader flashing red. Elena stood there for 7 seconds, then turned and found the stairs. Her boots echoed on the concrete steps, 1, 2, 3, 4, a sound that reminded her of Bagram Airfield at dawn, of running toward helicopters that were already warming up their rotors. Sophia's recovery room was on the 4th floor, room 412. Elena knew the hospital layout the way soldiers know maps of hostile territory. When she reached the door, 2 security guards were standing in front of it. They weren't aggressive. They didn't need to be. They simply existed between Elena and the room beyond, between her and the sound of a small girl breathing with machines helping. Dr. Ashford's orders, You're not authorized. The taller guard said it like he was sorry, like this was just his job and he didn't enjoy the work of keeping people from people they loved. Behind them, Elena could see into the recovery room. Commander Hayes was sitting beside Sophia's bed, his hand gripping the bed rail, his eyes red-rimmed and hollow with the kind of exhaustion that comes from knowing how close you came to losing everything. When he looked up and saw Elena through the doorway, his expression shifted. He started to stand. He knew. Whatever calculation was running in his mind, it recognized that this nurse, the one he had seen move with the precision of someone trained for emergencies, the one who had carried his daughter through the hospital while calling for surgical backup, this nurse had saved his child while his own family's rank and authority meant nothing. But before Commander Hayes could move, Patricia Dunn appeared, the charge nurse, Ashford's handpicked ally, a woman who had been standing beside him during morning rounds and had watched him humiliate Elena without flinching. Patricia held a manila envelope. Her face was sympathetic, which somehow made it worse than anger. Elena Martinez, this is official notice of suspension pending investigation into gross violations of chain of command, unauthorized medical treatment, and insubordination. The words sounded rehearsed. They probably were. Elena took the envelope. She didn't open it. She didn't need to. She could feel the weight of it, paper, policy, the institutional apparatus of a hospital closing ranks to protect one of its own. Behind Patricia, 3 doors down, Dr. Ashford stood at his office window with a phone pressed to his ear. He wasn't looking at Elena. He didn't need to. He had already won. The patient had been saved, which meant there was no evidence. The save proved that Elena had been right, which meant there had to be consequences severe enough to bury the truth under mountains of protocol violation. He was already making the next call, already strategizing the next move, a man who understood that power wasn't about being smart. It was about being willing to do what smart people hesitated over. Elena turned. She walked to the elevator. She didn't look back at Commander Hayes. She didn't acknowledge Patricia's sympathetic nod. The elevator doors opened. This one responded to her key card, the basement level, the psych ward, the place where they had decided she belonged, and she stepped inside. The descent took 52 seconds. She counted each one. The parking garage was empty except for her car, a 2009 Honda Civic with a check engine light that had been on for 3 months. She sat in the driver's seat without starting the engine. The garage smelled like motor oil and wet concrete. Somewhere above her, people in clean clothes and unbroken lives were getting ready for dinner. Somewhere above her, Sophia Hayes was waking up from anesthesia with her appendix removed and her father's hand in hers. Somewhere in a corner office, Dr. Ashford was finishing the phone calls that had dismantled Elena's career in the span of 6 hours. She reached beneath the collar of her scrubs and pulled out the single dog tag on its broken chain, the only piece of her past she had kept, the only evidence that Major Elena Martinez had ever existed outside this hospital. The chain was fractured, not from combat but from being pulled too hard in moments of panic. The dog tag itself bore her name and service number, engraved in faded letters that were barely readable anymore. She gripped it in her palm until the raised edges of the metal cut into her skin. Pain was information. Pain was data. Pain was the only thing that made her feel real. She sat there in the darkness of the parking garage with her hand closed around that dog tag, unable to move, unable to cry. The trembling wasn't fear. She had learned long ago that fear was a luxury. The trembling was something else entirely, something that came from having survived impossible things and then being destroyed by the ordinary machinery of institutional cowardice. The engine stayed off. The hours passed. And somewhere in Philadelphia, in a hospital that no longer wanted her, an 8-year-old girl lived because Elena had been willing to break every rule that mattered less than a child's life. Dr. Ashford's movements were precise. Calculated. He entered the administrative offices on the 5th floor at 11:44 p.m., well after Elena had carried Sophia to the surgical suite, well after the girl's appendix had been removed and the septic peritonitis flushed from her abdomen, well after Elena had been pulled from the surgical floor and reassigned before the anesthesiologist even finished closing. He sat at his desk, the leather chair creaking under his weight as he picked up the hospital phone and made the first call. Margaret Choi from Human Resources answered on the second ring despite the late hour. "We have a liability exposure," Ashford said, his voice steady as a metronome. "Nurse Martinez has demonstrated repeated insubordination and emotional involvement in a pediatric case. I'm recommending immediate suspension pending investigation." The second call went to Dr. Richard Chen, one of the 7 who had missed the appendicitis. "She undermined your authority," Ashford said into the phone. "She's dangerous to departmental unity. The board needs to understand that." The third call was to board chairman Gerald Pierce, a man whose country club membership overlapped with Ashford's by exactly 3 social circles. "We need to be proactive," Ashford explained. "I'm documenting everything. The family arrived with a Marine officer, possible litigation risk if we don't control the narrative now." Each call lasted exactly 2 minutes. Each one tightened the noose. By midnight, Elena's access card had been reprogrammed. By 1:15 a.m., a memo was printed on Ashford's letterhead citing Hospital Protocol Section 4.7.2, nurses demonstrating emotional involvement in treatment outcomes must be removed from direct patient contact pending psychiatric evaluation and fitness review. The memo specified Elena by name. It arrived in Sophia's recovery room file before Elena even knew Ashford had made the calls. She found out when she tried to enter the recovery unit at 6:38 a.m. on her next shift, a shift she didn't know had been changed. Her access card wouldn't work. The security reader beeped red 3 times. A nurse she didn't recognize, someone Ashford had handpicked for charge duty that morning, looked up from the station. "You're reassigned to psychiatric observation. Night shift. Starting tonight." Elena's voice came out level. "I need to check on my patient." "Not your patient anymore," the charge nurse said without looking at her. "Dr. Ashford's orders. You've got emotional involvement. Hospital protocol." The fluorescent lights buzzed overhead like angry insects. Elena could see Sophia's room through the glass partition 20 feet away. The child's small form barely created a bump under the white blanket. Monitors beeped their steady rhythm, a sound like water dripping in a basement. Elena stood there for 7 seconds, watching the girl breathe. Then she turned and walked out without another word, because trembling hands and raised voices wouldn't change what Ashford had already decided. The psychiatric rotation started at 10 p.m. Elena pushed a medication cart through dimly lit hallways filled with patients who weren't children and couldn't care less about a nurse's background. The overnight psych floor moved with a different rhythm, slower, heavier, the kind of quiet that comes from people who have given up on rescue. She worked through midnight, through 2 a.m., through the long hours when the hospital became a separate world. By 3:41 a.m., she was sitting in the break room with cold coffee and a patient chart she wasn't reading when Patricia Dunn, the charge nurse from pediatrics, Ashford's handpicked ally on the morning shift, appeared in the doorway holding a sealed envelope. Her face was carefully neutral. "Formal suspension notice," Patricia said, and she didn't meet Elena's eyes. "Effective immediately. Gross violations of chain of command. Insubordination. Undermining medical authority." Elena took the envelope but didn't open it. Patricia was still holding her gaze downward, refusing to look at the woman she'd just fired. "He's watching from his office," Patricia said quietly. "He wants to see you get it in person." Through the break room windows, Elena could see Ashford's office on the pediatrics floor across the corridor. He stood at his window, arms crossed, his face arranged in an expression of professional concern, the look of a man protecting his institution from contamination. Elena set the envelope on the table without opening it. "Sophia?" Patricia's voice cracked on the name. "She's awake. Stable. The surgery was clean. She's going to be okay." Elena felt something in her chest that wasn't quite relief and wasn't quite grief. She'd already known. She'd checked the surgical board at 4 a.m. when Ashford wasn't watching. But hearing it from Patricia's mouth made it real in a way the numbers on a chart couldn't. "Good," Elena said. That was all. Patricia left. Ashford remained at his window for another 90 seconds, watching Elena sit motionless at the break room table, then turned away. The next 48 hours dissolved into a kind of grey static. Elena went home to her apartment, a studio in northeast Philly with 2 windows that faced an alley and walls that seemed to absorb sound. She didn't sleep. She sat on her bed with the suspension letter and read it 3 times, her military training fighting against the present moment, trying to organize information into something survivable. Gross violations of chain of command. Emotional involvement. Repeated insubordination. No longer qualified for hospital duty pending psychological evaluation. The letter was dated 2 days ago. Ashford had written it before Sophia even coded. Before Elena saved her. Before he knew Elena was right. On the second day of her suspension, Elena drove back to Sacred Heart around 4 p.m. She wasn't thinking, or she was thinking but in the language of muscle memory, of protocols and procedures that didn't involve conscious choice. She sat in her 2015 Honda Civic, pale grey, 16 years old, in parking level B3 where the light was bad and the cameras had a blind spot. The engine was off. Her head rested against the steering wheel. The suspension letter sat unopened on the passenger seat next to her. No, that wasn't right. She had opened it. She was holding it. No. She was holding something else. Her left hand gripped the single dog tag on its broken chain, the one piece of her past she'd kept when she discharged from the Marines, the one her mother had given her on the day she left for Tikrit. The metal had cut into her palm hours ago and now she could feel blood drying there in a small line. She couldn't make herself let go. She couldn't make herself start the car. She couldn't move. 47 minutes passed. The fluorescent lights in the garage ceiling flickered in that particular way hospital lighting did, a rhythm that wasn't quite consistent, which made your brain keep waiting for them to fail completely. Elena's breathing had slowed to something near sleep, though sleep wasn't coming. Her eyes were closed. Her hands were bleeding and she didn't move to stop it. The dog tag pressed deeper into her palm with each breath. It was almost a relief, pain being information, pain being something honest after 2 days of administrative silence. Footsteps. Rubber-soled boots on concrete, a specific gait, left side favoring something, injury compensation. Elena's eyes snapped open. 20 feet away, a man in his mid-20s walked toward the ER entrance with his left arm in a sling, the arm itself wrapped in gauze that had taken on the translucent quality of medical tape. His right side was covered in tattoos, sleeves down to the wrists, the kind of body art that took years. He wore civilian clothes but moved like active duty, purposeful, economical, shoulders set against invisible weight. He was 30 feet past her car when he glanced in the window. Stopped. Backed up 3 careful steps. Stared. His mouth opened. Major Martinez. The words were loud, shocked, disbelieving. Elena's head snapped up so fast the dog tag drew fresh blood across her palm. She knew him immediately, Lance Corporal Davis, 24 years old, from Tikrit, from the summer when mortars fell almost daily and she'd spent 6 hours in a supply tent training him on 4 starts because his hands wouldn't stop shaking. Davis. The kid who'd watched her crack a patient's chest open with a combat knife because the tamponade was going to kill him otherwise. Davis, whose eyes had gone very wide and stayed that way. "It's just Elena now," she said, and she got out of the car slowly because leaving him seemed impossible and staying seemed equally impossible. But Davis was already moving toward the ER, his left arm cradled against his ribs, his mouth still forming her rank. "Martinez," he called again, louder. "Martinez, you're here." Elena followed him inside because protocol said to assess and because something deeper than protocol said this moment was already fracturing into something larger. The ER triage was running at moderate capacity. Davis checked in, got fast-tracked because of the obvious fracture, and was placed in Bay 4, where Drive Chen was rotating through, one of the 7 who had missed the appendicitis, one of the 7 Ashford had called at midnight. Elena helped Chen set the fracture. It was simple, clean, radial break, no displacement, straightforward reduction and cast. But Davis wouldn't stop talking. "You don't understand," he said, his voice carrying across the bay. "Major Martinez worked here. She saved my whole unit in Tikrit. She did a thoracotomy with a combat knife. She cracked a guy's chest open in the dirt while we were taking fire. She's a legend. She shouldn't be pushing medication carts. She's a major. She's decorated. You have no idea who you're looking at." Chen glanced at Elena 3 times during the fracture reduction. The 3rd time, he really looked. "You're a nurse here." Elena's voice was quiet. Her hands were steady, muscle memory holding firm while everything else was coming apart. "I'm suspended." That single word hung there. Not the past tense of herself. Chen finished taping the cast and called HR. Elena heard him say security clearance and database flag and "you should know about this" into the phone. Hospital protocol for suspension hearings required background verification. The wheels had already been in motion. The wheels were moving faster now. An hour later, Elena was in Margaret Choi's office on the administrative floor. Choi's hands trembled slightly as she opened a locked folder. "Major Martinez," Choi said carefully, "we need to understand exactly who you are." Elena's dog tag was visible now, outside her scrubs. Blood had dried on it. Her palm ached. She didn't answer because the truth was already beginning to move through the hospital's systems like dye through water, unstoppable, spreading, going to stain everything it touched. In 48 hours, there would be a hearing. In 72 hours, Ashford's world would begin to burn. But right now, in Margaret Choi's office, Elena sat perfectly still and said nothing because the quiet person in the room was the only one who understood what was about to happen. The conference room at Sacred Heart fell silent in the way that only happens when the world shifts on its axis. Margaret Choi, the hospital administrator, sat with Elena Martinez's personnel file open across her desk, personnel file that was not, technically, supposed to exist. The one with the redacted section that flagged a classified security clearance no civilian nurse should carry. The one that made her face go the color of old bone. She picked up the phone with fingers that didn't quite feel like her own and made 3 calls in succession. By 9:11 a.m., the board had convened an emergency hearing. The conference room was positioned on the 7th floor with windows overlooking Philadelphia's skyline, the kind of room where institutional power normally settled like sediment. Elena sat in a chair positioned deliberately away from the table, the way they always position people they'd already decided to destroy. Dr. Ashford was there, flanked by 2 board members. 4 chairs sat empty, the ones meant for the witnesses who would testify against her. Then Commander Hayes walked in. He wore his dress uniform. Dress blues, ribbons pressed sharp enough to cut, the insignia on his shoulder catching the fluorescent light. He moved to the center of the room with the kind of deliberate precision that made every administrator suddenly aware they were holding their breath. When he spoke, his voice cracked like concrete under pressure. "Major, my daughter is alive because of you." The room didn't just go quiet. The room went retrograde. Every person in that space felt the weight of those words, not as praise, but as testimony. As military-to-military acknowledgement. As truth delivered by a man whose authority made Ashford's position feel suddenly, catastrophically fragile. Elena didn't move. Didn't acknowledge the rank that had just been spoken aloud in front of institutional witnesses. But her hands, which had been folded in her lap, uncurled slowly. Just that. Just the uncurling of her hands like something finally permitted to breathe. Patricia Dunn, the charge nurse who had delivered Elena's suspension notice 3 days earlier, walked in carrying a file folder. Her hands were trembling as she approached the table, not from fear, but from the weight of understanding. She opened the folder and began to read, her voice barely above a whisper at first, then gathering strength with each line. Combat Commendation. Field Citation. Recognition for Medical Innovation Under Fire. Battlefield Trauma Surgery Certification. Triage Operations Commander, Fallujah, 2008. Bronze Star Recipient, 2009. Another Bronze Star, 2010. Purple Heart with Oak Leaf Cluster, 2011. Patricia looked up from the page. She ran triage operations under constant mortar fire. Constant fire. And she saved, her voice hitched. She swallowed hard and continued. 214 lives. Before the blast that took her out of service. 214 people are alive because of the woman we just tried to fire. The silence was so thick you could operate in it. The door opened again. This time it was a SEAL liaison officer. You could tell by the way he moved, by the way the room's air pressure changed when he entered. Not tall, but present in a way that made the architecture rearrange itself around his center line. He was carrying a leather service record, the kind that doesn't get circulated to civilian hospitals, the kind that requires cleared personnel to even handle. He stood and read Elena's decorations aloud. Bronze Star for Valor. Bronze Star for Merit. Purple Heart, Combat-Related Injury. Navy and Marine Corps Commendation Medal for Medical Excellence. She ran emergency medical operations in Tikrit under constant hostile fire for 14 months. Performed field thoracotomies with equipment that would make civilian surgeons weep. Trained field medics who became some of the best combat nurses in the Corps. He turned a page. His voice never wavered. She took mortar shrapnel protecting 3 junior corpsmen. She finished the surgery she was performing before she let anyone attend to her own wounds. When she was medically discharged, 17 personnel under her command requested transfers so they could follow her. That is not unusual. It is extraordinary. Dr. Ashford shifted in his chair like a man adjusting his weight before a fall. The liaison officer locked eyes with Ashford. Held it. The silence stretched like a rubber band at its breaking point. Dr. Ashford attempted to speak, to defend himself, to explain, to navigate away from the catastrophe now visible on every face in the room. The liaison officer raised one hand. Just raised it. And when he spoke, every word hit like a precision strike. You don't get to speak. The door opened a 3rd time. 2 figures in dark suits entered, moved to the far corner of the conference room, and stood with the particular stillness of federal agents who had run the same operation 17 times before. They carried identification that read FBI. They had a classified briefing document that they would not circulate. They had a single statement, Elena Martinez's medical expertise had assisted in a classified intelligence operation with direct impact on national security. Her security clearance was current. Her credentials were beyond reproach. The interview would be conducted privately, and they had transportation scheduled. Ashford's face had turned the color of wet ash. He opened his mouth. No sound emerged. He tried again. His voice, when it came, was hollow. She violated protocols. She acted without authorization. Stop. The SEAL liaison's voice was a blade. You had a nurse. A nurse with 14 years of combat medical experience, decorated multiple times for exactly the kind of judgment calls she made with your patient. You dismissed her. You humiliated her. You reassigned her when she was right. And you did it because she threatened your authority. Because a nurse, a woman, saw something you didn't. And you chose your ego over a child's life. By 11:13 a.m., the board had announced Ashford's immediate administrative leave pending investigation. By 4:44 p.m., Ashford sat in his office alone. His hands were shaking. Not with rage. With the particular tremor that comes when you realize the walls have collapsed. He spent 6 hours collecting himself, breathing through the techniques his therapist had taught him, calculating. By evening, he'd convinced himself that narrative control was still possible. That if he spoke first, if he shaped the story, if he positioned himself as a cautious administrator concerned about patient safety and psychiatric stability. By 8:48 p.m., he was sitting under studio lights at Channel 6 News across from Jennifer Walsh, anchor, with a makeup artist having just fixed the slight shine on his forehead. The real story here, Ashford said directly to camera, his voice carrying the practiced confidence of a man who had never been contradicted in his own institution, is about patient safety. This woman, Elena Martinez, hid her background. Her military background. Her psychological history. She kept a secret identity. She violated every protocol we have in place. She's a liability, and the hospital needs to. Walsh leaned forward. But she saved the child's life. Ashford's smile was the smile of a man who had already calculated this obstacle. She got lucky. But what happens when her combat trauma is triggered? What happens when her judgment is compromised by PTSD? We have a responsibility to ask these difficult questions. The studio phone rang. Walsh touched her earpiece, and something in her expression shifted, the barely perceptible change of a journalist who has just received information that rewrites the story. She looked directly at Ashford. Dr. Ashford, we have a call. Lieutenant General Marcus Holt, United States Marine Corps. He's asking to come on air. Ashford's jaw clenched. We didn't arrange. He's calling live. Walsh's voice had taken on the dangerous sweetness of someone who had just realized the interview was about to explode. General, you're on with Channel 6 News. The general's voice came through the speakers, calm and lethal as a sniper rifle. Dr. Ashford, I served with Major Martinez. Directly. I'd like to provide context for your viewers. 2 million people were watching across Philadelphia. Ashford could see the viewer count climbing on the monitor. The general continued without waiting for acknowledgement. Major Martinez saved my nephew's life in Tikrit with a battlefield procedure that 9 out of 10 civilian doctors couldn't perform in a hospital setting. I have reviewed her medical records. She has no PTSD diagnosis. She has ongoing clearances for classified work. She has a Purple Heart and a medical discharge after taking shrapnel saving other people. The general's voice hardened like steel cooling. What she does have, doctor, is the judgment to recognize a dying child when 7 board-certified physicians were too arrogant to listen. You didn't ignore her because she was unstable. You ignored her because she was a woman who threatened your authority. And a little girl almost died because of your ego. Ashford's face was chalk under the lights. The camera caught every second of it. Dr. Ashford? Walsh's voice was honey. Do you have a response? He didn't. He sat frozen for 7 seconds of dead air, an eternity on live television. 7 seconds of him realizing that the narrative was no longer his to control. By morning, the video had 4 million views. By that afternoon, the Pennsylvania Medical Board had suspended his license pending investigation. By the end of the week, Sacred Heart had terminated his employment. By the following Monday, malpractice attorneys representing Commander Hayes had begun filing against the 7 physicians who had missed the diagnosis. Dr. Ashford's 23-year career collapsed in 72 hours. 6 months later, Elena Martinez ran Sacred Heart's new emergency pediatric response unit from an office overlooking the parking garage where she had once sat unable to move. The single dog tag on its broken chain, the one piece of her past she had buried, now hung in a shadow box on her wall beside her bronze stars, beside her purple heart, beside all the things she had learned to stop hiding. Not displayed for show. Just there. True. Sophia Hayes came in every month for checkups. Commander Hayes brought coffee every time, a ritual of gratitude that had become their quiet language. Patricia Dunn worked as her second-in-command now, and in her own office, she had framed Elena's old personnel file with a caption underneath, "Listen to your nurses." 3 of the 7 doctors who had missed the diagnosis specifically requested transfers to Elena's unit to learn from her. Dr. Chen told her one Tuesday afternoon, "You taught me that hierarchy isn't the same as judgment. I'm sorry it took almost losing a child for me to understand." Elena just nodded. Keep learning. On a rainy Thursday, Elena passed a strip mall in northeast Philadelphia. Dr. Ashford sat at a folding table under a banner reading Liberty Supplemental Insurance, positioned between a nail salon and a vape shop. He was explaining policy benefits to an elderly woman who looked confused. He glanced up as Elena's car passed. Their eyes met for 1 second. His face showed nothing, not rage, not shame, just the exhausted defeat of a man who had discovered too late that the world did not exist for his convenience. Elena looked back at the road and kept driving. That evening, she trained a new pediatric nurse named Sarah who was nervous about questioning an attending's judgment. "What if I'm wrong?" Sarah asked, her voice small in the fluorescent-lit conference room. Elena touched the dog tag under her scrubs, unconscious now, muscle memory, and met her eyes. "What if you're right and you stay silent?" She paused. Let the question hang. The quietest person in the room might be holding it all together. But they might also be the only one seeing what everyone else is missing. Your job is to speak up. Let them decide if you're wrong. But make them hear you. Sarah nodded slowly. Elena went back to her charts. Outside, Philadelphia settled into dusk. Some battles choose you. The ones that matter are the ones where you choose to fight back. And sometimes, the most powerful weapon you carry isn't strength. It's the quiet refusal to disappear. If you've ever been underestimated by someone who didn't know your true value, hit that subscribe button and share this with someone who needs to remember, the quietest person in the room might be the only one who understands what matters. Tell us in the comments, have you ever had someone finally see you for who you really are?